If you're here, you probably already know the statistics, the response rates, the loss of response over time, the surgery rates. You know the numbers. But here's what those numbers don't show. Your specific situation, what you're actually dealing with day to day, and what you're hoping to get back to.
When patients come to us, they're often in one of a few places. Maybe you're on medications that are sort of working, you're still having breakthrough symptoms, or you're in remission but completely exhausted from the side effects. Some patients come to us before they've even started biologics, wanting to know if there's a way to avoid them or delay them safely. Others have been through multiple medications and are running out of options. Wherever you are, we meet you there.
Here is what integrative medicine actually means in practice. We're looking at your case through multiple lenses at the same time. We are asking, what is driving your inflammation? What is going on with your microbiome? Are there nutritional deficiencies holding back your healing? Is stress triggering flares? How could we support your body's natural healing capacity alongside your medical treatment? And here's what is important. We work with your existing healthcare provider. We're not replacing your gastroenterologist. We are adding an additional layer of support that many GI practices simply don't have the time or training to provide. It's about giving you the most comprehensive care possible.
You've probably heard integrated medicine 100 times, but here's what it actually looks like with us. Two patients can have the same diagnosis, the same medications, the same test results, and get completely different recommendations for us. Because we're not just treating Crohn's disease or ulcerative colitis. We're treating you with Crohn's disease or you with ulcerative colitis. That means understanding what remission looks like for you specifically. For some patients, that's getting back to competitive sports. For others, it's being able to work a full day without needing a net, or traveling internationally without panic about bathroom access. Your version of wellness is the goalpost.
On our website, we outline our 5-step approach, and I want to walk you through why each one of those steps matters. Step 1 is safety. Some IBD symptoms are so severe that they should be treated in a hospital, and we want to make sure that you're okay to be treated on an outpatient basis. We assess where you are right now, review your current medications, run necessary tests, and make sure we're coordinating with your care team. Nothing happens without this foundation. Step 2 is clinical remission, getting your symptoms under control so you can function again. Less pain, more regular bowel movements, energy coming back. Step 3 is serologic remission. We look at inflammatory markers in your blood and stool because even when you're feeling better, we need to know that inflammation isn't still quietly damaging your tissues. Step 4 is called histologic remission. This is actual tissue healing. This is the gold standard that reduces your risk of complications, hospitalization, and disease progression. And finally, step 5 is maintenance. Most treatment plans stop way back at step 2, symptom control. You feel better, so treatment seems to be working. But we've had many patients feel fine for a long time, and then later they flare, or imaging reveals that they had inflammation the whole time, increasing their risk for stricture or colon cancer or other things. For us, maintenance is where the real work begins. We create a sustainable plan that keeps you in remission while you're actually living your life. We don't stop until we see real, lasting healing.
So if you're reading our website and thinking, this sounds different from what I've experienced before, you're right, it is.
We're not just managing your IBD. We're partnering with you to rebuild your health from the ground up.
And we're really, really good at what we do. Ready to get started?